what I'm going to present, it's the cancer and sexual health subgroup. It's not already constituted, but I hope it will be very soon, and it will we will work on that pretty soon. Cancer is a major health problem, especially in the most developed countries, and in men and women, prostate and breast cancer are very big problems with big numbers, but also colorectal cancer, which is a pelvic cancer, and stomach and liver, lung as well, who are cancers that need a multidisciplinary approach and many treatments. They can have a very, very big impact on sexual health, as well as blood cancers like leukemias or lymphomas, and testicular cancer, which are cancer that approach to younger patients, and they can leave sequelae for a longer time. Fortunately, prostate and breast cancer have big a big survival rate, as well as cervix and also pelvic cancers. And we are dealing not only with survival, but we have to look have to look beyond the horizon in what cancer matters. We have to anticipate the sexual side effects of cancer and its treatments, and to minimize the impact of cancer diagnosis and management. As I said, cancer is no longer only a question of survival, but also a matter of preserving quality of life in every individual dimension, and I mean sexual health included. In our working group, we developed some templates in specific topics. I developed with some other persons the cancer and sexual health. This is a 9-page document, which is available in the document on the file list of our website, and you can see it through the document. You can consult it, and you can have a more detailed vision on that. So the background is that the cancer diagnosis have a negative effect on the quality of life, not only of the patient, but also of the partner. There is a tendency to inability to maintain intimacy and a healthy shared sexual life. And it's a clear lack of information by now about cancer and their impact and its impact on patients and partners. So discussing sexual consequences of cancer, it's a must since the diagnosis, since the beginning, because sex unavailability of the patient, it's presumed by the patient and also by the partner and the social network of the patient. No approach in cancer deserves to be called holistic as long as sexuality and intimacy have not been adequately addressed. So we went through a review from the last 5 years, and we considered different dimensions: the male and female, sexual and gender identity differences, patient side, partner side, physical condition differences like anatomical, hormonal, neurotransmitters, culturally different aspects, and the educational different aspects. And the results, these are some of the results. As I said, you can go more deeply in the document. And it's clear that there are some lack of studies about the impact on sexuality of what we call the non-genital cancers, or the cancer that don't have a direct affection of the erogenous zones. And patients clearly report that they would welcome information about sexual matters because some of them feel ashamed to have sexual feelings when so threatened by cancer. If sexuality is mentioned in the early stages of treatment, the sexual outcome may be better, and sexual well-being benefits the recovery and healing oncological process, not only in a psychology manner, but also in a hormonal and neurotransmitter level. The impact of sexuality can be, as you might understand, very high in some cancer, like, for example, head and neck cancers, affecting almost all patients, giving a very very big alteration on their self-image. Even in the terminal stage of cancer, being questioned about sexuality and intimacy makes patients feel that they are still seen as alive or as sexual human being. And there is a high prevalence of sexual dysfunction in those populations. On the other hand, there is a very low education for professional healthcare, professional in healthcare, and the most barriers to avoid discussing the sexual function were lack of time, lack of training, and advanced stage of the patient. There is some information available online about cancer and sexual health from oncological societies, but in general, they lack addressing lesbian, bisexual, transgender, and gender non-conforming needs. What can or should be done? We have to, from my point of view, promote multidisciplinary teams, especially in cancer treatment centers. We have to educate professionals and patients in this specific area and fill in the gap in research in the ectosexual, but also in LGBTQI+ individuals concerning cancers other than the classic prostate and breast, in which we have the most studies. And for policymakers, we have to make them see that free of charge access to sexual rehabilitation protocols after cancer treatments might be beneficial for patients and also for the environment in hospitals. What questions can we raise in our network? Accessibility to an oncosexology multidisciplinary team in different European Union countries. How accessible how is the access in different countries? Which are the inequities between European countries related to the cost of treatments, like PDA5, valprostatidil, for example, for erectile dysfunction, or for female sexual dysfunction, vaginal dilators, lubricants, breast prosthesis? Which difference are there between countries? Are men and women equally treated? Are there sexual and gender identity differences? Is the partner also addressed? Are there specific in-country programs related to oncosexology? And about this point, I'm very curious about next presentation of Elinek, which comes from the Netherlands. It seems to me that it's the most advanced European country in this specific topic. And links, meetings, and common protocols between oncosexology, multidisciplinary teams, and centers, which is a name for this network. A question that I would like to ask is why physiotherapy is available after an orthopedic surgery, but there's no free access to sexual rehabilitation after a cancer treatment? It's an example. From the part of the deliverables, the input from different members about their own country examples about oncosexology and mapping differences, I would like to have a booklet in different languages directed to professionals and patients covering the oncological patient sexual health needs. The development of an online site about oncosexology at an European level for patients and professionals, and with an educational side on it, like online seminars. The development of an app with specific recommendations for cancer patients in order to enhance their sexual health. And this app could be used with, for example, a gamification tool, as we heard from Francisco, in a way of making research, education, and also to extract some data. A manifest for policymakers stating reasons and evidences about the benefits of sexual medicine is a need. And animated videos for the European Sexual Medicine Network sites and for our YouTube channel. This was the first guide for the educational video, for the animated video. which is already available, and I would like to show to you.
The diagnosis of cancer is a life-changing experience. Most people feel confused, fear, worried, and overwhelmed. Daily routine may change, and treatments bring weakness and dependency. Nearly all patients diagnosed with cancer experience some kind of sexual problems: low sexual desire, difficulty to get aroused, inability to reach orgasm, body image concerns. These sequelae can be temporary, but in many cases they are long-lasting and can also affect the partner. Sexual outcome may be better if sexuality is addressed in the early stages of diagnosis and treatment. The impact of the cancer treatment on sexuality must be discussed before it starts. Questions, myths, and doubts must be clarified beforehand, and a rehabilitation plan should be established. Talk with your doctor or healthcare provider about the importance of sexuality in your life. Sexual intimacy helps to make the experience of cancer more manageable and seems to assist in the recovery process. Sexual intimacy can help dealing with feelings of distress, reduces pain, anxiety, and depression, enhances sleep, self-esteem, and emotional bond with the partner. Oncosexology aims at increasing the awareness of sexual issues in oncology care and stresses the importance of addressing the issues to prevent the development of chronic sexual dysfunctions, problems, or worries. Sex, sexuality, and intimacy are just as important for people with cancer as they are for persons who don't have cancer. It's safe to have sex while dealing with cancer. Talk to your doctor about your sexual concerns before and after treatment.
This is the first of 10 videos, which will be developed very soon. Can you hear me now? It's awful to be in a virtual meeting because we don't have feedback.
We can hear you very well.
Okay, so this is the city where I live, the city where I work. It has one of the oldest university in Europe. It's Coimbra. And this is the center where I work in. It's called the Portuguese Institute of Oncology. And we only deal, this is our campus, we only deal with cancer patients. And since 5 years from now, we developed a multidisciplinary oncosexology team. The ones that looked at New Amsterdam, the TV series, will recognize this expression, how can we help? And this is a multi-oncosexology team that go through all the dimensions of the cancer treatment and the rehabilitation from a sexual point of view. And I would like to organize the first cancer and sexual health subgroup meeting. This is a suggestion only for January 2022, a working group 1 and 2, and perhaps new members from joining ESMN. These are some examples. Deja and Heavy, thank you for your help in building this video building the template as well. I add some names that are already in our network, like Ellen Lam, Ilianek, Jacques van Legveld, Lucan Croce, and Stephanie Booth. We have some kind of link with this area, but also other names that were suggested, and they are not already in the network, like Lisa Newmal or Ricardo Godinho, which is the coordinator of my oncosexology multidisciplinary team, and of course Wout Dianoten, who is considered the father of this area. Of course, you are all free to and very welcome to join this subgroup, and I think that we can have very fruitful meetings and fruitful deliverables and work from in this cancer and sexual health subgroup. Thank you.